Welcome to our podcast, where we uncover the meanings, uses, and collocations of important vocabulary words.
We're thrilled you've joined us and hope this detailed exploration enriches your language learning journey.
Today, we will discuss the words hay fever, a rash, an allergy, asthma, diabetes, cancer, and heart attack. Let us start with hay fever, which is an illness affecting the eyes, nose, and throat caused by breathing in pollen.
People with hay fever might experience sneezing, itchy eyes, and a runny nose when pollen counts are high.
A frequent collocation is seasonal hay fever, describing symptoms triggered in spring or summer.
Another phrase is severe hay fever, which indicates more intense reactions like persistent sneezing.
Some individuals say, "I suffer from hay fever every spring," highlighting the recurring nature.
You could also hear about allergic rhinitis, a clinical term sometimes used interchangeably with hay fever.
Over-the-counter medications for hay fever often include antihistamines or nasal sprays.
Doctors may advise wearing sunglasses outdoors to reduce eye irritation linked to hay fever.
A common suggestion is to monitor hay fever symptoms via a pollen forecast app.
If you have hay fever, limiting outdoor activities during peak pollen hours can offer relief.
Certain local honey brands are said to help mild hay fever by building tolerance to regional pollens.
While not proven for everyone, some find that approach beneficial in managing their hay fever.
Some people with hay fever also develop mild headaches when pollen concentrations are extreme.
In more sensitive cases, hay fever can aggravate other respiratory conditions like asthma.
Schools sometimes accommodate students with hay fever by allowing them to sit away from open windows.
An air purifier at home can lessen the discomfort caused by persistent hay fever symptoms.
For serious cases of hay fever, allergists may suggest immunotherapy to build long-term tolerance.
This treatment can significantly reduce sneezing and eye irritation for chronic hay fever sufferers.
Next is a rash, referring to a red area of spots commonly caused by an illness or allergy.
You might see a rash on someone's skin if they come into contact with an irritant or allergen.
A frequent collocation is an itchy rash, highlighting the unpleasant urge to scratch.
Another common phrase is a widespread rash, indicating it covers a large portion of the body.
Doctors often examine a rash to determine whether it's viral, bacterial, or allergy-related.
If you have a rash that doesn't improve, medical advice is recommended for accurate treatment.
People sometimes say, "I broke out in a rash after trying that new detergent," reflecting a contact allergy.
Over-the-counter creams can help soothe a rash by reducing inflammation and itchiness.
In children, a rash could result from chickenpox, measles, or contact with certain plants.
Some foods can trigger a rash if a person is allergic, such as peanuts or shellfish.
You might hear about a heat rash during summer, caused by excessive sweating and trapped moisture.
A stress rash is a term used when emotional tension triggers skin flare-ups in sensitive individuals.
Healthcare professionals look for patterns in a rash to diagnose conditions like eczema or psoriasis.
Describing a rash accurately, its color, size, and spread, helps doctors identify the cause.
For mild cases, home remedies for a rash can include cool compresses or gentle lotions.
More persistent forms of a rash may require prescription medication and longer-term care.
Now let's examine an allergy, a condition that makes you ill when you eat, touch, or breathe certain things.
This word can appear in collocations like food allergy or allergy to pollen.
An allergy can be minor with mild itching or life-threatening if it causes anaphylaxis.
People often mention nut allergy or dairy allergy when discussing dietary restrictions.
A typical phrase is allergic reaction, describing how the body responds to an allergy trigger.
Some say, "I have an allergy to bee stings," underscoring the need for EpiPen readiness.
An allergy test might involve skin prick methods, where a doctor checks your reaction to specific substances.
Children with an allergy to peanuts often avoid processed foods that could contain traces.
Some workplaces accommodate employees who have an allergy to strong scents by restricting perfume use.
You may hear about an allergy flare-up, referencing a sudden onslaught of sneezing or hives.
An allergy can cause discomfort in daily life, from constant itching to digestive issues.
Doctors sometimes say that an allergy can develop over time, even if you had no issues before.
Many report an allergy to pet dander, experiencing runny noses around cats or dogs.
In severe forms, an allergy may affect breathing, especially if it's coupled with asthma.
Let's move on to asthma, a condition that gives people breathing difficulties.
Collocations include severe asthma, indicating pronounced symptoms like wheezing or chest tightness.
Another common phrase is asthma attack, referring to an acute episode where breathing becomes labored.
People with asthma often carry inhalers, which deliver medication to open the airways.
Exercise-induced asthma can flare up when someone is physically active, causing shortness of breath.
Weather changes, especially cold air, can also trigger asthma in susceptible individuals.
Some individuals say, "My asthma is acting up," when pollutants or allergens worsen their breathing.
Schools often keep notes about students' asthma to assist in case of sudden attacks.
Doctors might recommend peak flow meters to monitor asthma symptoms and lung capacity.
An asthma management plan usually involves medication, lifestyle adjustments, and routine checkups.
People with both asthma and allergies may experience heightened sensitivity to triggers like dust.
Frequent coughing can signal poorly controlled asthma, requiring medical review.
Some say, "I outgrew my childhood asthma," indicating it's possible for symptoms to fade over time.
Nonetheless, severe asthma can last a lifetime, demanding ongoing attention and care.
Next, we discuss diabetes, a disease caused by an inability to control the level of sugar in the blood.
Common collocations include type 1 diabetes and type 2 diabetes, denoting two main forms.
Another phrase is gestational diabetes, a condition that sometimes occurs during pregnancy.
People with diabetes may require insulin injections or oral medications to regulate blood glucose.
Diabetes management often involves monitoring carbohydrate intake and staying active.
Some say, "I was diagnosed with diabetes at an early age," highlighting lifelong management needs.
Blood tests, such as the A1C, track how well diabetes is controlled over a few months.
Doctors emphasize the role of a balanced diet in preventing complications from diabetes.
A diabetes care plan might include regular foot checks to catch circulation problems early.
Complications of diabetes can be serious, including nerve damage and vision loss if neglected.
Some individuals talk about reversing prediabetes through weight loss and healthy eating.
Family history may raise the risk of diabetes, increasing the need for screening and lifestyle changes.
People often mention living with diabetes, underscoring the lifelong adjustments required.
Regular monitoring devices now make diabetes easier to manage, offering continuous glucose readings.
Moving on to cancer, which can be a very serious illness in which a lump grows in the body.
Collocations include lung cancer, breast cancer, and skin cancer, among many others.
Another phrase is cancer screening, indicating tests designed to catch tumors at early stages.
If someone says, "I'm in remission from cancer," it means the disease has subsided significantly.
Treatments for cancer often include surgery, chemotherapy, or radiation, depending on the type.
People sometimes reference terminal cancer when the prognosis is very limited.
Early detection is key for many cancer types, as it improves the odds of successful treatment.
Some talk about cancer prevention, focusing on lifestyle factors like diet, exercise, and avoiding tobacco.
Emphasizing awareness campaigns for cancer can encourage more regular checkups and screening.
Some individuals manage chronic forms of cancer over many years with targeted therapies.
Oncoplastic surgeons specialize in reconstructive procedures for cancer patients needing tissue removal.
Support groups and counseling help people cope with the emotional toll of cancer.
Family history often plays a role in cancer risks, prompting genetic testing for some patients.
Encouraging loved ones to seek professional advice at the first sign of cancer can save lives.
Our final word is heart attack, a sudden, serious illness when the heart stops working correctly.
Collocations include massive heart attack or mild heart attack, indicating severity levels.
Another phrase is heart attack symptoms, such as chest pain, shortness of breath, and nausea.
Doctors urge people to call emergency services immediately if heart attack signs appear.
Some mention silent heart attack, which presents minimal symptoms but can be life-threatening.
Risk factors for a heart attack include high cholesterol, high blood pressure, and smoking.
A heart attack occurs when blood flow to part of the heart is blocked, damaging muscle tissue.
Rehabilitation after a heart attack typically includes medication, exercise, and dietary changes.
People sometimes speak of heart-healthy habits to reduce the risk of heart attack.
Managing stress can also lower the odds of experiencing a heart attack in susceptible individuals.
Some note that family history impacts heart attack likelihood, increasing the need for routine checkups.
Community programs emphasize CPR training to assist heart attack victims before paramedics arrive.
Now, let us dive deeper into hay fever with extended examples and collocations.
If you hear severe hay fever season, it's common during late spring when flowers pollinate heavily.
A hay fever sufferer might say they dread the high pollen count days, marking more pronounced symptoms.
Locally sourced honey is sometimes marketed as a hay fever remedy, though results vary by person.
Some healthcare professionals differentiate between perennial hay fever and seasonal hay fever.
Perennial hay fever implies year-round reactions, often due to dust mites or pet dander.
For a rash, let's explore more contexts.
A rash might be described as blotchy or spotty when providing details to a doctor.
A rash can also be labeled as acute or chronic, indicating duration.
Parents might worry about a rash spreading and keep their child home from school.
For an allergy, additional insights broaden our understanding.
People can have an allergy to certain medications, requiring them to carry an alert card.
Workplace policies sometimes accommodate staff with an allergy by banning specific foods or items.
An allergy can be described as mild when symptoms are minor but still noticeable.
Turning to asthma, more details can clarify its impact.
Uncontrolled asthma can lead to frequent hospital visits, underscoring the need for proper management.
Some mention occupational asthma, linked to chemicals or dust in certain jobs.
Childhood asthma can subside with age, but doctors advise vigilant monitoring.
With diabetes, additional context solidifies the concept.
Insulin-dependent diabetes refers to patients who require daily insulin injections.
Others have diet-controlled diabetes, meaning proper meals and exercise manage their condition.
Borderline diabetes is sometimes called prediabetes, signaling high sugar levels needing intervention.
On cancer, let us add deeper scenarios.
Campaigns like breast cancer awareness promote mammogram screenings and early detection.
Prostate cancer often emerges in older men, highlighting the importance of regular checkups.
Aggressive cancer signals fast-growing tumors that demand immediate, rigorous treatment.
Addressing heart attack, we delve into further details.
Cardiac arrest can occur during a heart attack, but might also happen spontaneously.
Mini heart attack is a colloquial term for a mild myocardial infarction, yet it's still serious.
Medical teams often refer to heart attack, in technical language, as myocardial infarction.
Let us interconnect these words in broader contexts to illustrate usage.
Someone with hay fever might be more prone to an allergy overall, sharing risk factors such as a sensitive immune system.
If a rash appears in someone with diabetes, doctors investigate circulation or possible infections.
People with asthma might also experience complications if an allergy triggers respiratory distress.
Cancer can develop in anyone, though heart attack risk also rises with age and poor lifestyle habits.
Detecting a lump early can help diagnose cancer at more treatable stages, whether benign or malignant.
An allergy test might reveal that a patient's hay fever is specifically triggered by grass pollen.
If an asthma patient experiences constant flare-ups, it might indicate an allergy or sensitivity to dust mites.
You can manage diabetes effectively with insulin while still controlling a rash caused by dryness or poor circulation.
In some cases, ignoring diabetes can be potentially fatal, similar to advanced cancer.
Let us consider real-life scenarios to reinforce these words in context.
Imagine a person with hay fever who develops a rash from a new detergent, indicating an allergy to certain chemicals.
This same person could have asthma, which flares up due to high pollen, further complicating respiratory function.
Over time, they might be at risk for diabetes if lifestyle factors and diet aren't balanced.
Meanwhile, a family member could receive a cancer diagnosis and undergo rigorous treatment, emphasizing early detection.
Another relative might suffer a heart attack due to high cholesterol, hereditary factors, or stress.
These terms show that health issues often intertwine, making knowledge and prevention crucial.
Familiarizing yourself with hay fever, a rash, an allergy, asthma, diabetes, cancer, and heart attack is key for personal well-being.
Now, let's add more collocations for hay fever.
You might hear hay fever relief, referring to strategies that help reduce symptoms during allergy seasons.
Some mention chronic hay fever, describing persistent suffering and repeated flare-ups.
Hay fever medication is an umbrella term for antihistamines, decongestants, and nasal sprays.
Further collocations for a rash.
Sudden rash might suggest an acute allergic reaction to food or contact with an irritant.
Localized rash indicates that a rash appears in one spot, like the arm or neck.
People frequently speak about treating a rash with mild creams or anti-inflammatory ointments.
Extended collocations for an allergy.
Allergy-friendly products cater to those with an allergy by removing common triggers.
Allergy season overlaps with hay fever months, meaning heightened pollen in the air.
Severe allergy might lead to anaphylaxis, requiring immediate medical intervention.
More on asthma.
Asthma symptoms range from chest tightness and wheezing to persistent coughing at night.
Asthma triggers can include pet dander, smoke, or even intense exercise.
Mild asthma indicates infrequent attacks, while severe asthma demands more consistent monitoring.
Additional phrases with diabetes.
Diabetes complications cover neuropathy, kidney damage, and vision problems.
Juvenile diabetes is an older term for type 1 in children, now more commonly called type 1 diabetes.
Controlling diabetes refers to maintaining stable blood sugar through medication and diet.
Broader collocations for cancer.
Cancer cells can spread, metastasize to other parts of the body if not detected early.
Cancer ward is a specialized hospital unit for oncology patients.
Some speak of cancer survivors, celebrating those who overcame the illness.
Expanded collocations for heart attack.
Warning signs of heart attack include dizziness, cold sweat, and left arm pain.
After a heart attack, cardiac rehab programs help with gradual recovery and lifestyle adjustments.
Some refer to heart attack risk factors, like obesity, smoking, or prolonged stress.
Let us present a longer scenario incorporating multiple words.
Consider an individual with hay fever, so strong it interferes with breathing, hinting at asthma.
They also discover an allergy to nuts, so they must watch for a rash if they eat anything contaminated.
At a checkup, they learn they have prediabetes, requiring them to alter their diet to avoid full-blown diabetes.
A family member is diagnosed with cancer, reinforcing the importance of regular screenings for lumps.
Another relative experiences a heart attack, reminding everyone to manage cholesterol and stress.
By addressing these conditions proactively, people can improve health outcomes and well-being.
This interconnectedness of hay fever, a rash, an allergy, asthma, diabetes, cancer, and heart attack illustrates how prevention and awareness matter.
Thank you for following this extensive exploration of key vocabulary, examples, and collocations.
We encourage you to revisit these terms: hay fever, a rash, an allergy, asthma, diabetes, cancer, and heart attack, to solidify your understanding.
Practicing these words in conversation enables you to communicate confidently about health topics.
Whether describing personal experiences or discussing broader medical issues, these words empower clear, accurate expression.
Join us again for another podcast episode, where we delve into more English vocabulary with in-depth explanations.
Until then, keep exploring language and remember that consistent exposure fosters lasting improvement. Wishing you success in mastering these terms and applying them in everyday life.